Welcome to Life Revised PLLC's training on suicide prevention to learn what it is that you can do to help prevent suicide by Michelle Palacios, licensed professional counselor supervisor in the state of Texas. Suicide is a very real problem and epidemic in America. If you weren't aware, you should know by the end of this training that if you don't know somebody who has tried to commit suicide or completed suicide, the chances are you will at some point in your life. Let's look at some statistics. According to the American Foundation for Suicide Prevention, suicide is the 10th leading cause of death in the United States. For every suicide that's completed, at least 25 attempt. There are 121 suicides daily, and firearms account for almost 50% of all suicides. As awful as those statistics are, some people are under the misconception that suicide is something that only affects older adults. That is unfortunately not the case. The Jason Foundation has several statistics on their website to include the fact that suicide is the second leading cause of death for ages 10 to 24. More teens and young adults die from suicide than from cancer, heart disease, AIDS, birth defects, strokes, pneumonia, influenza, and chronic lung disease combined. Each day in our nation, there are an average of 5,240 attempts by young people in grades 7 through 12. And 4 out of 5 teens who have actually attempted suicide have given clear warning signs. As scary and alarming as the suicide statistics are, it's important to remember that suicide is preventable. Prevention starts with being aware and knowing what the risk factors are. The more risk factors that somebody has, the higher their chance of attempting or completing suicide. One of the risk factors we need to look at first are the health risk factors. These include mental health issues such as depression, bipolar, schizophrenia, borderline personality disorder, antisocial personality disorder, conduct disorder, psychotic disorders, anxiety disorders, substance abuse disorders, serious chronic health pain, and PTSD. According to the Foundation for Suicide Prevention, some of the other risk factors that we need to consider are the environmental risk factors. Stressful life events such as death, divorce, or job loss, prolonged stress factors such as bullying, relationship problems, or unemployment, access to lethal means such as guns. Remember in the suicide statistics, we learned that 50% of suicides are caused by guns. Exposure to another person's suicide or to graphic sensationalized accounts of suicide on social media or otherwise also help create a higher risk factor for a person to be suicidal. In addition to health and environmental factors, we need to look at historical factors as well. If a person has had previous suicide attempts or has a family history of suicide attempts, their risk factor increases. When considering risk factors, it's important to remember that not everyone gives signs. Not everyone that has these risk factors is suicidal, and not everyone that is suicidal has these risk factors. So then how do you know if one of your loved ones needs help? While it's important to know that some people will not give any signs when they're feeling suicidal, it's also important to know that most of the time when somebody is feeling suicidal, they will give certain warning signs. So what are those warning signs that we need to be aware of? Of course, we know if they have risk factors, as we mentioned in the training before. That's definitely a warning sign for suicide. Also, verbal threats, direct or indirect, saying things like, you'd be better off without me, maybe I won't be around, I should just kill myself, are all warning signs and should be taken very seriously. In our culture, sometimes we talk about wanting to kill ourselves and as a kind of a light way to blow off a situation. But I encourage you to take it seriously and always ask if somebody says that they want to kill themselves, just to make sure. People who express feelings of hopelessness or helplessness are at risk for suicide. These are people who feel like they don't know how things are going to get better or they just can't see the light at the end of the tunnel. That's a definite warning sign for suicide. People who take daring or risk-taking behavior are at risk for suicide. It could be something like driving too fast or recklessly, or any kind of life-threatening behavior. It may be a warning sign for suicide. We need to look out for personality changes as well. When someone's feeling suicidal, they might not be themselves. They might be more irritable. They might lock themselves up in a room and not be social as much as they used to be. Those are important things to note as potential warning signs for suicide. Sometimes when somebody is preparing for their suicide, they will give away their prized possessions to their loved ones as a way to prepare and get ready for it. A lack of interest in future plans can also be a sign that suicide could be pending. Talking about wanting to kill themselves or wanting to die is a sign of suicide. Looking for a means to kill themselves, like looking for a gun or trying to find pills, are definitely signs for suicide. Talking about not having any reason to live is a warning sign. Talking about feeling trapped or in unbearable pain is also a warning sign for suicide. Other warning signs for suicide include talking about being a burden to others, increasing their use of alcohol or drugs. This is a dangerous warning sign because the use of alcohol or drugs can definitely diminish your inhibitions and make it a little easier to convince yourself to commit suicide. Acting anxious or agitated, sleeping too much or too little, withdrawing and isolating themselves, showing rage or talking about revenge, extreme mood swings, visiting or calling people to say goodbye are all warning signs for suicide, as well as feelings of depression, loss of interest, rage, irritability, humiliation, and anxiety. According to the Jason Foundation, when somebody tells you that they may be feeling suicidal, or you may have noticed some of the warning signs, it's very important to stay calm. Although you may feel shocked and overwhelmed, stay relaxed. This will help the person to open up to you and prevent them from shutting down. Don't give up hope and don't panic. Set an environment up so that it makes it comfortable for them to open up. One of the ways to do this is to use active listening skills, which I'll discuss in a moment. Do not leave them alone. Talk about it. Many times people are afraid to talk about suicide directly, but it's important to discuss it. You are not putting the idea into their head if you ask them directly if they are suicidal. It actually helps give the person relief and opens up the door for them to talk about some serious feelings that they might be having. Do not minimize or dismiss their problems. Acknowledge their feelings and tell them how much you care. This isn't the time to tell them that they shouldn't feel suicidal because their problems aren't big enough. It's also not the time to tell them that you have experienced worse in your life. Just focus on listening to them and acknowledging how it is that they are feeling and conveying the message that you care. Do not dare them to do it. Although this might seem like a silly don't, some people are misinformed by thinking that if they dare the person will realize that they indeed do not have what it takes to go through and try to commit suicide. This is a very dangerous thing to do. Do not dare them to do it. Don't debate on whether suicide is right or wrong, good or bad. This is not the time for that. Do not lecture. The majority of who should be talking during this kind of conversation should be the person who is potentially feeling suicidal. Take it seriously. It allows the person, again, to open up more. Do not be judgmental, and do not incite feelings of guilt. This is not a good time to talk about how sad that it makes you, or how so-and-so would feel so bad, or that they are even overreacting. Communicate openly and communicate frequently. Make it clear that you care and that you are willing to listen. Allow for the expression of all feelings and accept them. This does not mean that you think it is okay for them to be suicidal. This just means that you're willing to listen and to understand how it is that they are feeling. Ask if they feel suicidal, then ask if they have a plan. If they have a plan, the more thought out it is, the higher the risk. Then you're going to want to act. Do not leave them alone, and get help immediately. You can call their doctor, go to the nearest hospital or emergency room, or call 911. Be sure to limit their access to all lethal means, including firearms, medication, or any other lethal method for suicide. Do not attempt to be the hero. Suicide is a very serious thing and can be very overwhelming and trigger all kinds of feelings for everybody involved. Your best bet is to get help and get support. Remember that you are not the counselor. Do not force the person to open up to you and only get help from you. Allow them to know all the different opportunities and avenues that they have to relieve some of these feelings. Get support. Never attempt to physically take away a weapon. This can put yourself in danger, and it can further aggravate the suicidal person. Tell. Do not promise confidentiality, and if you do, break it. Be sure to tell someone else to get this person the help that they need. Do not fall into what the Jason Foundation calls the not my child syndrome. I like to call it the not my loved one syndrome. People who believe this think that suicide only happens to children or loved ones that come from dysfunctional families, and that is not the case. Depression and suicide do not discriminate. Sometimes people think that their loved one could not possibly feel suicidal because they have everything that they ask for and come from a perfect family and have a perfect life. This is not true. Depression is a chemical imbalance and can happen to anybody, no matter how perfect you may think that their life is. Plus, you never really know everything that a person is having to deal with in their day-to-day life. So do not fall for this syndrome and take it seriously if you notice one of your loved ones is experiencing any of these warning signs or risk factors. Listening well to the person who is suicidal is one of the most powerful things that you can do to get them help. Some people aren't aware of how to be a good listener, so here are some skills. First, you want to acknowledge the speaker. This can be simple as a head nod or an uh-huh. By acknowledging the speaker, you're letting them know that you are listening to what they have to say and reminding yourself to pay attention to what is being said to you. Respond verbally. Asking questions or making statements that help clarify what the speaker is saying are very good ways to let the speaker know that you're really paying attention and listening to what they have to say and that you think what they're saying is important. It reminds the speaker that you are attentive and that you are truly there to help them and that you really are concerned. Make sure that you let the speaker finish before asking any questions. Do your best to not interrupt them as they're speaking. When the person is done talking, you're going to want to summarize what you heard them say, reflecting on not only the content of the message they were trying to tell you, but also trying to point out the feelings that you heard them talking about will be a powerful way to let them know that you are here and you hear them. Repeating phrases or summarizing what the speaker says shows that you're putting in an effort to better understand them. Use phrases like, "What I'm hearing is," or "It sounds like you're saying." These tactics can allow the speaker to hear what they are saying, which may help them find positive reinforcement. The majority of communication between two people is not through the words that they speak, but through the body language which we show. So if you're listening to somebody who is suicidal, make sure that you look the part. Keep eye contact, maintain good posture, stay focused. Those are key components of active listening and good interpersonal communication. Being distracted and unfocused gives the speaker the impression that you are not paying attention. When you actively listen to someone, you're letting them know that you care about what they are saying, and then you can indicate that you are concerned for their safety. Once you have identified that a person is feeling suicidal, it is vital that you get them the professional help that they need. According to Mental Health America, there is no single treatment that works for everyone. However, there are many different types of treatments to try. One of those is inpatient treatment. This is for people who are in danger to themselves or others. The patient will stay there for several days while they are in a safe setting being constantly monitored. A psychiatrist will give them medication to help them to decrease their depressive symptoms and decrease the feelings of suicidality. They might participate in group therapy and even family therapy at this time. Once a person is no longer suicidal and they feel they are safe to themselves and others, they may be released to an intensive outpatient program. This consists of group therapy where they work on skills to help them deal with suicidal thoughts. They might talk about their feelings and their problems in a group of other people who might be experiencing some similar situations. They could stay there all day or half a day, but at the end of the day, they get to go home. After that, outpatient therapy, specifically CBT, is a good option for people who are feeling suicidal. This is done in an in-office setting, typically once a week for about 45 to 50 minutes. Here, the client will learn different coping skills and be allowed to talk about their problems as well as resolve the core conflict that was causing them to feel suicidal. Medications are also an option. Medications are to be monitored by a doctor and are never to be discontinued without discussing it with the doctor first. If somebody is actively suicidal, meaning they have already attempted or they are in process of attempting suicide, call 911 immediately or go to a local emergency room. Also, these are some numbers and website addresses that you can go to if somebody's feeling suicidal and just wants to talk to somebody. Of course, always contact a professional like your doctor or a mental health therapist if you have any questions about how to handle suicidal behavior.